The Source.
All right, 5 minutes after 10 o'clock. Wow, the morning is just flying, isn't it?
Yeah, it is. It's great.
Angela Brice Smith is on the air. She's the Deputy Consortium Administrator for Atlanta, Georgia, and Dallas, Texas, and the Regional Administrator for the Centers for Medicare and Medicaid Services. And she's got some information about the new Medicare cards. Good morning, Angela. Thank you for being on our show.
Oh, good morning, Larry.
What do we need here? What do we need to know about the new cards?
The new card, the main thing to keep in mind with the new card is we are removing the Social Security number from that card. And we're doing that in large part because we're putting our patients first, and we're doing what we can to really protect them from identity theft that we know is often associated with that Social Security number.
Yeah, and I guess that's something everybody's been wanting for a long time, right?
Yeah, we've noticed a little bit of a trend, and then Congress passed legislation, I think in 2015, to basically mandate it, and we want to make sure we do it in a methodical manner, and we're going to do it, probably by, I think the mandate said by April of 2019. We're well on our way to making sure we get that done throughout the country and the U.S. territory.
And Florida is one of those states.
Absolutely. Florida is more than 4.3 million beneficiaries in the state, and that's an important number in terms of the 59 million that are in the entire program. So Florida's big.
Does Medicare itself change from year to year? Does the president in office make a difference, or is it kind of immune from whatever decisions are made at that level?
The card has absolutely nothing to do with the person's benefit or coverage. This is really about protecting from the identity theft. It won't have any bearing on that whatsoever. The other thing, though, to keep in mind is, in Florida, there's a high penetration rate or high number of beneficiaries who are members of Medicare Advantage plans or HMOs or PPOs. Keep in mind, in that situation, they use their primary card, that HMO plan or that PPO plan, but they should also keep that new Medicare card once they receive it.
So once they receive that new Medicare card, what do they do with the old one?
Oh, good question. What we want them to do with that old card is to destroy it by shredding it or cutting it up and then disposing of it in the trash. We don't want it just to be in whole, put in the trash. That's really, really not good. Shred it up, cut it up appropriately, and then dispose of it.
When is this going to happen? Is it something this week?
Yeah, we're expecting that for the 4.3 million people that are in Wave 5, referring to this, we're doing it in a lot of different waves, about 7 altogether. We're in Wave 5, Florida, South Carolina, North Carolina, Georgia, and Alabama are part of that wave. So the 4.3 million beneficiaries in Florida will be getting their card over the next month.
Will it be up to the recipient of the new Medicare card to let their healthcare professionals know, or will the healthcare professionals be notified by Medicare itself?
Well, we have alerted all of the provider community and the stakeholders to be ready for the new card, because oftentimes the systems have to be updated a little bit because we're moving from 9 digits, for example, to 11 digits in the new Medicare card number. So that is a key part, and they will have the capability to look up the beneficiary's new Medicare card number, but at the same time, the new Medicare card should be presented to the provider, typically at the time of service as requested for that service.
And is there anything in the digits that will be unique? Because if I have a Florida driver's license and the last 2 digits of my birth year is incorporated in that number.
No, there is no embedded intelligence in terms of the number, but it is a unique number to the beneficiary in terms of those 11 alphanumeric characters that are making up that number.
Is there anything in the works that would make the Medicare card no longer necessary to be physical? Like, could it be in our phones, for example?
Well, we haven't gone that far in terms of technology to putting it in our in phones. We do have the capability that once the Medicare beneficiary has established a My Medicare account, that they have the capability to print out a new card, because they will still be paper. And some people have expressed interest in lamination and why we didn't laminate it and things like that. In large part, we didn't laminate it because many of the provider communities still like to make copies or scan it, and that lamination was not conducive to that. So what we've done is we still keep it paper, but if they do have a My Medicare account, they can print out another card for themselves at their leisure.
When should a person sign up for Medicare?
Oh, sign up for Medicare, it's usually by the time you're 65, but I would certainly encourage you to touch base with the State Health Insurance Assistance Program in every state to keep you apprised of the enrollment periods. You need to get enrolled, preferably at the right time before you turn 65.
Oh, my.
Well, the clock is ticking for Robin and me.
I know. It's ticking.
Yeah, we're getting there.
That's why you're asking.
Yeah, that's why we're asking. Yeah, we're here.
Open enrollment period is coming up this fall.
Oh, okay. Well.
So next fall for us, right?
That's right.
Next fall is prior to the big 6-5. Yeah.
Okay.
How do you keep the states separate on the Medicare numbers? Is there something special about the state that the person resides in?
You're getting probably to the address issue. One of the things that we are, the main point in terms of the mailing of the card is it is based off of where you are, where you're getting your Social Security address, where you're getting your benefit, where you originally signed up. And if you haven't changed it, and there are a lot of people who have moved to Florida or maybe it's just a temporary move, who knows. But if you have permanently moved since you started getting Social Security, then you should update your address as soon as possible. And you can certainly do that through 1-800 number for SSA or Social Security Administration, or go to a local office.
Where are you, Angela? Where do you work, or where do you live?
I am based in Dallas, Texas. But I cover all 13 states in Atlanta, and the Atlanta regional office and the Dallas regional office that are part of the Centers for Medicare and Medicaid Services.
Before we say goodbye, is it just Medicare.gov for any questions maybe we didn't ask that somebody's thinking of wondering about? Is that the website, Medicare.gov?
Medicare.gov/new card.
Oh, okay. /
And that's sort of the generic one. And then if they establish, there's a way you can also establish an account directly with Medicare as mymedicare.gov.
Mymedicare.gov.
Got it.
Right.
Okay, very good. Okay. Well, Angela, thank you for being on the air with us today. Hopefully this information is making its way. I wonder how many people didn't realize there was a new card being issued.
That's why we're telling as many people as we can. It's really important. When you think about the 59 million Medicare beneficiaries, we've got to do whatever we can to make sure they're informed.
See, I was under the impression the new cards were in everybody's hands already. We had information about it, but this is to let them know a new card is on its way.
Mm-hmm.
Yep, it's coming.
Yeah. Now, real quickly, can we laminate them ourselves, or does that ruin them?
I would probably say it's probably a better idea to kind of protect them in plastic, like you used to do old school, I guess, maybe with pictures in your wallet. That's probably the best way, because many of the providers need to scan them or copy them, and the lamination may be an issue.
Just the problem with that. Yeah. Oh, wow. I never thought of that. Well, Angela, thank you for sharing that information with our listeners.
Okay.
All
Look
right.
forward to you enrolling next year.
I am.
I don't know. Oh, man. All right. Well, thank you. Thank you, Angela. We'll be right back.
Okay.
Hello, gorgeous.
Hi, this is Becky at Hello Gorgeous Salon. We are located in the heart of downtown Ocala, right next to the historic Marion Theater. I'd like to invite you to stop by and see our new boutique area and meet our staff of professional stylists. Here at Hello Gorgeous, we are ready to update your look with the latest trends. And with summer here, it's the perfect time to brighten up your look. So make your appointment now for those highlights and Brazilian blowout. But don't stop there. We are a full-service salon offering manicures, pedicures, and facials also. So if you've been searching for a salon to call your own,